Hey there, friends. It's Pharmacist Michael. If you or someone you love takes gabapentin for pain, you need to hear this. As some of you know, I'm a board-certified clinical pharmacist, and I spent many years working on a senior psychiatric unit. I've treated a lot of patients with dementia, and I'm passionate about not only managing it, but also helping to prevent it whenever possible. So when I come across a study that links a common medication, especially one as widely used as gabapentin, to a potential increased risk of dementia, I dig into the data. And today, I want to share what I found. Before we talk risks, let's talk about what this drug is actually used for. Gabapentin was originally developed to treat seizures, but it's now much more commonly used for chronic nerve pain, including chronic low back pain. Doctors often prescribe it off-label to avoid opiates, but it's also used for anxiety, restless legs, and sleep issues. And while it can help, it also affects the brain. So long-term use, especially in people already at risk for cognitive problems, raises some big red flags. So, what did this new research actually show? A new 2024 study looked at over 26,000 adults with chronic low back pain. They excluded anyone who already had dementia, epilepsy, stroke, or cancer to get a cleaner picture. They found that people who received 6 or more gabapentin prescriptions were at a significantly higher risk of developing dementia and mild cognitive impairment. But what really caught my attention was the relative risk numbers. Let me explain what that means, because it's important. Relative risk is a way of comparing how likely something is to happen in one group versus another. So in this study, a relative risk of 1.29 means that people taking gabapentin were 29% more likely to develop dementia than those who didn't take it. And a relative risk of 1.85 for cognitive impairment, that means an 85% higher chance of developing it if you were in the gabapentin group. Those are big risk numbers. Now here's the shocker. In younger adults, those between 18 and 64, gabapentin users had more than double the risk of developing both dementia and cognitive impairment. And people with 12 or more prescriptions saw even higher risks. The more prescriptions they filled, the greater the risk. Numbers don't lie, but what do they really mean for your health? This doesn't mean everyone on gabapentin will get dementia, but it does suggest a pattern, a dose-response relationship, where more frequent use equals more risk. If you're under 65 and taking gabapentin long-term, especially at higher doses or with other brain-active medications, this is something to seriously think about. Your doctor may not bring this up because the data is still emerging, but it's worth asking. Is this medication still the best choice for me? Don't panic, but do be proactive. If you're currently on gabapentin, here's what I recommend. Don't stop suddenly. Talk to your doctor about tapering if needed. Track your brain health to notice any new forgetfulness, brain fog, or confusion. Reassess the benefit. Is gabapentin still helping, or are the risks outweighing the rewards? Explore alternatives like physical therapy, CBT for pain, anti-inflammatory diets, turmeric, omega-3s, or low-dose antidepressants. Sometimes it's not about removing the drug immediately, but making smarter, more personalized decisions about your long-term health. This hits close to home for me. Having worked in a geriatric psych unit, I've seen firsthand how devastating dementia can be, not just for the patient, but for their whole family. That's why when I see data like this, I feel obligated to share it. We all deserve informed choices. Gabapentin can still be helpful, but it's not benign. And if you're younger and using it frequently, it might be time to reconsider the strategy. Your brain is priceless. Protect it. If you found this video helpful, please give it a thumbs up, subscribe, and share it with someone who might be taking gabapentin right now. Your brain is worth protecting every single day. Drop a comment below if you've experienced brain fog, memory loss, or other cognitive changes on gabapentin. Let's open the conversation. I'm Pharmacist Michael. Be informed, be empowered, be happy, and be healthy. And I'll see you in the next video.